What is a bubble study echocardiogram for stroke diagnosis? Imagine a tiny bubble traveling through your blood vessels, helping doctors uncover hidden connections in your heart that might be causing strokes. That's essentially what a bubble study echocardiogram does. It's a special ultrasound test used to find abnormal blood flow between the right and left sides of the heart. This abnormal flow, called a right-to-left shunt, can sometimes allow blood clots from the veins to bypass the lungs and reach the brain, leading to a stroke. The test is especially helpful when a stroke has no clear cause, known as a cryptogenic stroke. During the procedure, a saline solution mixed with tiny air bubbles is injected into a vein, usually in the arm. These bubbles travel to the right side of the heart. Normally, the lungs filter out these bubbles, so they shouldn't reach the left side of the heart. But if there's a hole like a patent foramen ovale or an atrial septal defect, the bubbles can cross from the right to the left atrium. Once there, they enter the systemic circulation and can travel to the brain, which can be seen during the ultrasound images. The ultrasound part of the test can be done in two ways. One is called transthoracic echocardiography, where the probe is placed on the chest. The other is transesophageal echocardiography, where a probe is inserted into the esophagus to get clearer images of the heart. Sometimes, a test called transcranial Doppler is used, which is more sensitive in detecting these shunts by listening for bubbles in the brain's blood vessels. To make the shunt more visible, patients are often asked to perform a Valsalva maneuver, like coughing or straining, during the test. This temporarily increases pressure in the right side of the heart, making it easier to see if bubbles cross through a hole. Detecting a patent foramen ovale or other shunts is important because it can explain how a blood clot from the veins bypasses the lungs, filtering system, and causes a stroke. Knowing this can influence treatment options, such as blood thinners or even closing the hole to prevent future strokes. This test is generally safe, minimally invasive, and provides valuable information about the heart's structure and function. It's often recommended after a stroke that doesn't have an obvious cause, especially in younger patients or those with a history of blood clots or migraines. While it's a useful tool, doctors follow guidelines to decide when it's appropriate, avoiding unnecessary testing. Overall, a bubble study echocardiogram is a key part of understanding stroke causes and helping guide effective prevention strategies. If you or someone you know has experienced a stroke, talking with a healthcare professional about this test can help determine if it's right for you.